Med history.
Hypervitaminosis is a pathological condition characterized by an excess of one or more vitamins in the body. The main reason in the vast majority of cases is the intake of large amounts of vitamin-containing drugs in the form of tablets or injections. The clinical picture is extremely diverse and varies, depending on the overdose of a particular vitamin. Diagnosis is carried out using clinical anamnestic data and determination of high vitamin content in the blood. Treatment implies the immediate withdrawal of vitamin drugs. Detoxification and pathogenetic therapy may be required. The main reason is the increased intake of vitamins from the outside, mainly in the form of medicines or food additives. Much less often, hypervitaminosis occurs due to alimentary causes. The following are the etiological factors of elevated vitamin levels in the blood. Preventive reception. The use of drugs containing vitamins, outside of indications, in the absence of hypo or vitamin deficiency for a long time, often causes hypervitaminosis. This is facilitated by universal, often erroneous beliefs about vitamin supplements as an essential component of a healthy lifestyle. As a result, they are taken to strengthen the immune system, especially vitamin C, as antioxidants, etc. Treatment. In addition to eliminating hypovitaminous conditions, rickets, vitamins are used to treat various diseases. Vitamin A in ophthalmology and dermatology, B vitamins, to alleviate radicular syndrome in protrusions and herniated discs. Moreover, very high doses are prescribed to achieve a therapeutic effect. Prolonged use can lead to toxic concentrations of micronutrients in the blood. Food. The most striking example is hypervitaminosis A when eating polar bear liver, which contains an extremely large amount of retinol. Diseases. Hypervitaminosis is not always a consequence of an overdose of vitamin preparations. In some cases, it can occur due to various diseases, including very severe ones. For example, hypervitaminosis B12 may indicate the presence of solid tumors, hemoblastases, liver diseases, etc. There are also predisposing factors, for example, hypersensitivity to vitamin D, due to which hypervitaminosis develops even when taking physiological doses. Hypersensitivity can be both genetic, due to mutation of vitamin D receptors, and occur a second time in chronic granulomatous diseases. Clinical manifestations have their own characteristics in different vitamins. However, it is possible to identify some common symptoms that occur with an overdose of all vitamins. These include allergic reactions, hyperemia of the skin, dyspeptic disorders, loss of appetite, nausea, vomiting. Below is a more detailed clinical picture of various hypervitaminoses. With hypervitaminosis A, due to hypercarotenemia, the color of the skin turns orange, which is especially clearly noticeable on the palms and soles. There is also dryness and peeling of the skin, loss of eyebrows. Intracranial hypertension provokes constant headaches. With an acute overdose of vitamin D, the patient's condition is severe. Anorexia, severe abdominal pain. Due to profuse diarrhea, constant vomiting, and polyuria, signs of dehydration quickly occur. Reduced skin turgor, low blood pressure. The neuropsychiatric status has been changed. Arousal, motor anxiety is replaced by lethargy and lethargy. The patient feels a strong heartbeat and heart failure. With hypervitaminosis B6, the clinical picture is dominated by signs of peripheral neuropathy. A person experiences a feeling of weakness and a deterioration in vibrational sensitivity. The control over the position of the body deteriorates, significant difficulties of movement in the dark, violation of proprioception. At the same time, pain, tactile and temperature sensitivity are preserved. Although the toxic effects of increased concentrations of some vitamins are already well known, the pathogenesis of many of them is still unclear. Hypervitaminosis E-K most B vitamins. Hypervitaminoses of fat-soluble vitamins, ADK, are the most dangerous for health and life, since they accumulate in adipose tissues. An excess of vitamin A, retinol, significantly slows down the development of bone and cartilage tissues and the differentiation of embryo cells. Also, high doses of vitamin A can cause hepatotoxicity and, in combination with tetracycline antibiotics, lead to benign intracranial hypertension, pseudotumor syndrome of the brain. Hypervitaminosis D strongly affects phosphorus-calcium metabolism. Excessive absorption of calcium from the gastrointestinal tract leads to hypercalcemia and calcium deposition on the walls of blood vessels and renal tubules. The accumulation of calcium in smooth muscle cells leads to an increase in blood pressure and hypertension. Filling of the renal tubules can cause acute renal failure. Vitamin B6 in large doses suppresses the activity of nociceptive neurons of the posterior horns of the spinal cord, which leads to a decrease in the conduction of pain signals in the peripheral nervous system, which may be useful in the treatment of radiculopathy. However, prolonged use of excessive amounts of vitamin B6 can be neurotoxic, since the neurons of the spinal cord are damaged, which causes a violation of vibrational and proprioceptive sensitivity. Some hypervitaminoses are manifested in newborns. The addition of large doses of vitamin K can lead to the destruction of erythrocyte membranes, which can cause hemolytic anemia and nuclear jaundice. Complications. Hypervitaminosis is characterized by a large number of complications, especially for fat-soluble vitamins. High doses of retinol have a teratogenic effect, causing birth defects in the fetus. Prolonged hypervitaminosis A is accompanied by osteoporosis and an increased risk of fractures. It is possible to develop toxic hepatitis with acute liver failure. Administration of high doses of vitamin E to newborns causes necrotic enterocolitis and sepsis. In adults, hypervitaminosis E can trigger hemorrhagic stroke and prostate cancer. Vitamin C is excreted in the urine in the form of oxalates during metabolism, so taking an inadequately large amount of ascorbic acid leads to urolithiasis. Hypervitaminosis C in patients with thalassemia and hemochromatosis worsens iron overload. Diagnosis of hypervitaminosis. To diagnose hypervitaminosis, they turn to internists or pediatricians. When collecting anamnesis, it is necessary to find out whether the patient takes any types of vitamins. Upon examination, signs such as dryness or discoloration of the skin, a subfebrile increase in body temperature may be detected. Physical examination may show low blood pressure, muffled heart tones, enlarged liver and spleen. Laboratory tests help to determine the concentration of vitamins. Additional diagnostic methods may include a general blood test, which may show an increase in hematocrit due to dehydration, which may lead to a false increase in other indicators. Biochemical blood analysis to identify markers of liver and kidney damage. Urine analysis to detect pH bias and other indicators. Radiation examinations such as bone X-ray and ultrasound of the abdominal cavity. Ophthalmological examination to identify signs of hypervitaminosis in the eyes. Differential diagnosis is usually not required, since the clinical picture and laboratory data allow you to determine the level of a particular vitamin. However, hypervitaminosis B12 can be an indicator of a malignant neoplasm, so high concentrations of this vitamin require an oncological search.